And so I threw together some slides of kind of like common questions, some of the common data questions that we get a lot, where we're at with schools, and then from a clinical perspective, some questions we have about that too. So I'll try to be cognizant of time. I might, if I talk about each slide in depth, we can talk for a while, but I'll try to move things along. So this is kind of my plan. So I want to give Washington State specifically, talk a little bit about Skamania County. Not as much data there we have to work with, obviously. I wanted to talk about where we're at with schools, some of their common questions we get with COVID-19, clinical stuff, and a tiny bit about like what does this pandemic look like going forward, which we don't know, but we can always speculate a little bit. Okay, so this is cumulative for the state of Washington, 63,000 cases. Again, total, this is not current, total hospitalizations, 6,000, almost 1,700 deaths. And this is what's called an epidemiological curve or an epi curve. So it's kind of like daily cases counted by illness onset day. So you can see we had our peak around early April in cases, and then another peak late July. And it seems, at least the last couple of weeks, that Washington State as a whole case counts have started to decrease. It's still at a significantly elevated level if you compare it to where we were at in May. So these are a number of cases that we're getting reported across Washington State every day. Some of that is explained by increase in testing, but certainly not all of it. And this is hospitalizations for the whole state. Again, peaking in April, and then leveling out, flattening the curve as we kind of talked about doing in May and June. And then unfortunately, just a pretty steady kind of increase since June, essentially, in hospitalizations across the state. Certainly not as high a spike as we had in April. I think partly that is due to we're doing a better job, honestly, of protecting our more vulnerable populations. We haven't seen many cases in long-term care facilities and places like that. Younger people in general are less likely to be hospitalized, and they've hit a little bit harder more recently. But I'm not a huge fan of just that slow increase, and I hope we also peak with that soon as well and start heading down. So this is daily hospitalizations kind of each day across Washington. The Institute for Disease Modeling does some really interesting modeling data. They released a report on the 7th, and they talk about this term, which I think we've talked about a little bit in the past, the reproductive rate. And here they call it RE, which is effective reproductive rate. Reproductive rate is kind of it's a little bit hard to explain, but it's essentially for one person that's infected with COVID-19, how many people on average is that person going to infect? So if that number is over 1, then we're going to see case rates continue to increase. One person will infect, 1.5 other people on average. Those 1.5 people will infect another 1.5 people. It's easier with whole numbers, but I'll show you on a graph on the next page, and we'll kind of see how it's changed over time.